Welcome to Empowering Plans, a show dedicated to identifying waste and undue expense in the health benefits industry, discovering ways to maximize benefits while minimizing costs, and empowering employers, administrators, and consultants to emphasize, once again, the benefit in benefit plan. Today's episode is brought to you by the FIA Group, empowering plans since 1999. Now here are your hosts, the FIA Group's own CEO, Adam Russo, and Senior Vice President and General Counsel, Ron Peck.
And Brady.
Hello, everybody, and welcome to another episode of Empowering Plans with the FIA Group. I'm your long-time, yet missing host. I haven't been here in a while, Ron.
Long-time suffering host, yeah.
Guys, my name's Adam Russo. I missed this podcast so much. I just was hoping, praying that we could just do one today. Pat Santos, our amazing producer, happened to be in the office, and everyone's in a great mood today, except for me.
I'm sorry.
So, guys, it's Adam Russo, co-founder and CEO of the FIA Group. Alongside me, Ron Peck. Say hello, Ron.
Hello, Ron.
Brady Bizzarro. Say hello, Brady.
Hello, Brady.
Guys, that game last night.
Yeah.
You know, I hate the Patriots, but I almost feel bad for Patriots fans. It's like having the perfect wife or the perfect girlfriend, and like they just die. Anyone you have after that, you'll be disappointed. It's like when you fly first class, and then you have to go back to coach. Like you fly first class on a Dreamliner, and then after that you're told every flight has to be on Southwest.
Wait a second. Are you implying that at some point this is going to end?
I mean, the guy, based on the way he played yesterday, probably could play until he's 90. Maybe he's immortal. That's possible too. But one day, he's not going to be there. Just switch teams, switch allegiances, because you will never, ever have what you had yesterday.
You know what's crazy, Adam? I was actually thinking about this was a few podcast episodes past. We did a podcast where at that point, the Browns actually had the same record as the Patriots.
Yes.
And we were talking about, you know, how the Patriots were looking a little down and the Browns were looking up and that this could be the year. Look, even I get tired of winning sometimes, you know, but not
Too
this
much
time.
winning.
Not this
Perfection.
time.
The guy's literally perfect. And I just feel bad because that will never happen again.
You know what also?
Once he's gone, you'll never have it again.
You know what? You say that, but what would happen if they draft this
His son.
rookie who ends up being amazing and it just keeps going?
It's impossible.
What I'm going to miss, too, is seeing the name Brady on everyone's backs. I'm going to miss that, too, because I see that everywhere. and
Well,
I
don't
have
you
for
want to
so
be the
many
best
years.
Brady?
It's been great. It's been great.
Folks, I don't know. It's sickening, but it's also amazing to see in person as a non-Patriots fan. Just to watch the perfection is incredible. It's almost like the other team knows when it's 3rd and 10. Oh, he's going to convert it. Anyways, let's get back to talking about healthcare. I know it's boring for most people, but not for us. We love this stuff. And guys, funny story. So I have a really good friend. I'm not going to say his name to protect his identity, but his kids go to school. My kids. He's a great guy. He's a great doctor, and he's been a practicing doctor now for, I'm assuming, almost 20 years. And over the past few months, we get together once a month. We're actually getting together tonight. And over the past, every time we see each other, he talks about how much less he likes being a doctor.
Oh, no.
Every time. The patients, but mostly it's about the health insurance, the coding, just over and over again. Like, he just feels like he's not doing what he thought he was going to be doing when he graduated from medical school. And so I guess he listened to our podcast, or he actually read some of our stuff or our webinars. And he brought up to me last night at my house, came over. Again, also hates the Patriots as well. I try to surround myself with people like that. But he was like, hey, I watched some video of you speaking at like a free market medical association. He's like, are there other doctors like me that go to these things? Is there another way that I could join a group practice where we could have our own prices? Like, he's asking me about it because he's getting fed up with the system. So here's what I noticed. When I spoke at the Austin FMMA conference about 2 weeks ago, there were more people at that chapter meeting than 5 years ago. We went to the first FMMA meeting in Oklahoma City.
The
There was
national
more people
meeting,
at the one chapter event than we saw at the national event when it first started.
Wow.
So this thing is growing. And just speaking to a doctor from Norwell who's having the same feeling, wanting to look into it. He wanted to actually come to the FMMA meeting this week that we're having in Massachusetts, but obviously he couldn't go. It's last minute. But I just wanted to share that with you guys to show what's going on in the growth of DPC and just the growth of free market medical.
Yeah, you know, Adam, it's very interesting you bring this up, and I know we didn't really discuss this beforehand, so I'm really glad you're bringing this topic up. I actually just finished a blog post for our social media and for the website. I don't think we've even posted it yet, but the topic that I wrote about is the fact that as payers, we've been taking a very sort of adversarial approach when it comes to providers, sort of payer versus payee. And granted, there's a lot of practices as far as pricing and things from the provider market that have got us up in arms, but it's gotten to the point where we talk about doctors, hospitals, as if they are literally these demons coming up from the bowels of hell, looking to sort of drag us down into the fiery depths. And we've made them out to be our enemies, when in truth, from an outsider sort of objective perspective, if you look at it, if healthcare, which is comprised of both the payer and the provider, can't get their act together and collaborate, then someone outside this system is going to come in and try to fix it. And I could tell you, and I guess now is probably a good time to sort of make an announcement publicly, that my wife, and I had mentioned in podcasts past, she was diagnosed back in July with non-Hodgkin's lymphoma. It appears that she is in complete remission.
Great news, Ron.
They can't say cured until a couple of years go by.
No one's ever cured, I think.
No one ever cured, right? But it's one of those things where, having gone through that, these doctors and the hospital that treated her, I look at them as heroes, right? So many of my friends that growing up are doctors, right? So the thing is, we have to maybe step back, stop treating them like the enemy, and realize they're part of a broken system the way we are. And instead of taking this adversarial approach all the time, maybe look at the system as a whole, how we could actually collaborate and work together.
You know what, Ron? It's funny. One of the things I was just reading about actually the other day, the phenomenon called physician burnout has been in the news more recently than not. And at first, for people who are at home or wherever you're listening to this podcast, hopefully maybe you're driving to work, you may think of that term and think, burnout, yes, being a doctor is tough. You have a lot of patients. You're working long hours. You're dealing with tough situations. In fact, the article I was reading about, they were burned out because of the administrative red tape.
That's the whole point.
Because they need 5 different admin people to help them with billing and getting through all the. They just want to treat patients. They want to do what they went to medical school to do, and they're burnt out from all of the administrative crap, frankly.
And here's another funny thing. So, folks, I'm not trying to pat Fee on the back, but I guess I'm going to. I was at a meeting last week, and it ties into our whole goal for 2019. And what we're trying to tell our clients and what we're trying to tell the industry is basically these are the things that you need to be offering to your empowered employers. More and more employers nowadays don't need to be told, why it's important to be self-fund or why it's important to offer good benefits to the employees. Employers now want answers. They're now demanding action from brokers, from the administrators, from experts. So what we're going into administrators and telling them, these are the things that you need to start offering to be relevant, to stay in business. This isn't like, oh yeah, start looking at these things to try to add more revenue for yourselves. No. If you don't start doing these things for the employers out there, you won't have any clients. So last week I got to visit one of our longtime clients. And what was amazing to me is it wasn't like I was there to sell. It was like, let's sit down and let's just talk about what are the things that you're seeing, what's FIA seeing, what are the things that we need to start doing as an organization to make sure that we continue to be relevant. Not to be relevant, but to continue to be relevant, because things are changing. And we're not going to see any help in DC. When you see like my doctor friend, the fact is more and more people are saying, we want an option like direct primary care. We want an option like on-site clinics. We want an option, how do we lower the overall price of specialty drugs? Like, they want answers. So unless you're able to actually empower your plans to control what you're doing from spending-wise and also from a plan design standpoint, you're not going to be empowered, and you will lose those clients. I just wanted to get your opinion on that, guys, because it was a very uplifting feeling for me to spend 3 hours with a client, not talking about how we could sell them more subrogation services, but this is what is happening. These are what the clients and brokers are demanding, and this is what we could do to help you get you there.
Yeah, so Adam, do you truly think that hospitals, physicians, doctors want to bankrupt employers? They want to bankrupt their patients? They want, like Brady said, this burnout? No. So I think the problem is we almost take this approach where we think that they want to engage in this kind of behavior. And I think it's more just a symptom of, like I said, a broken process or system rather than intent on the part of the provider. And Adam, like you say, you're talking to this doctor and he's saying, are there options out there? Are there alternatives? Yeah, there are. So I think that it behooves us as payers to not only identify better ways to create a plan that provides payment, but also to provide options and opportunities from the provider perspective to stay viable, stay profitable, and work with us so that it works as a system as a whole. Because like I said before, if we can't fix both sides of the healthcare system, payer and payee being the provider, like I said before, someone's going to come in and do it for us.
Like, I want to get Brady's perspective on this. So Ron is on the Government Relations Committee at SIA. I'm the chairman of SIA. And, we obviously have to have a position in regards to the surprise medical bills, the patient medical bills, the surprise billing. And all everyone wants to talk about is, in-network versus out-of-network. It's like, guys, everybody, men, women, whoever you are, children, I don't care who you are. Let's focus on what the problem is. Why is this bill so big in the first place?
Yeah.
Like, okay, this idea that, the way we get rid of surprise billing is by making everyone go in-network. Okay, so we get rid of the balance billing so people aren't surprised by some random bill that appears at their doorstep. By instead, let's hide all the overbilling in the network contract, and somebody's still paying for it. It's just not an individual person. It's the system. It's like, let's hide it by just having these fees still be excessive, but just have it hidden so that no one actually knows they exist. It's against the idea of transparency. It's an absolute crap.
Yeah, I think the problem is that in the context of balanced billing reform discussions, it's sort of lost in the discussion the issue of who is the payer here, because I think in the national level, the payer is always seems to be the insurance company, the fully insured world, but the solutions that I'm reading about, or the proposed solutions to fix balanced billing problems, still leave the plan paying a lot of money. They're about helping the consumer, the patient, and that's important. But I think, and part of what SAI is doing is trying to steer the discussion towards solutions that, like you said, address the reason the bill is so big to begin with.
Right.
So that the payer has support and relief. And also, that would be good, a trickle-down effect, in other words, for the patient as well, because you'll see lower contribution costs, lower premiums. So that's one of the things I think is important, because this is an issue area where I think, will see some bipartisan support in this year and maybe some legislation. And so I hope that the legislation that emerges in Congress will not just address, like you said, by masking the problem or shifting it to this in-network thing, but perhaps keeping the spotlight on the real issue underlying this, which is why the bill's so big in the first place.
It's like if you walk into your basement and you smell like a musty odor. Like, the idea, like, what they're thinking is, just hang a bunch of deodorant sticks in the basement and that smell will go away.
Sure,
Like,
it's a cover.
no, like, there's a problem. You have to figure out what the problem is. And every single thing is about, okay, it's too loud. It's too messy. Let's just hide it over there. It's not the solution that's going to make any change. I almost feel like we're better off, like, our company, selfishly, the fact that no one's come up with a solution allows us to exist, I guess. Because if people actually wanted to solve these problems, you wouldn't need cost containment firms. If the costs were already contained,
Right.
So maybe we should shut up.
Yeah, right.
Not talk about this anymore.
Adam, when your physician, when your doctor friend is, signing someone up for a test or prescribing some sort of a medication, do you think he knows what the cost is? Do you think he knows what the charge is? Maybe if he's part of a hospital system, he's been told, hey, listen, you need to make sure that you're going through these steps, you're doing these things, but they don't know why, right? And then when we talk to the billing department and there's this balanced bill, and we say, why is it so excessive? Why is that charge so high? I don't know. It's in the charge master.
Right.
Well, who came up with that charge master?
Right.
I don't know. They don't know either. So the reason why nobody's asking the hard questions and doing any kind of that self-searching, soul-searching, reevaluation at the provider level is for the same reason you brought up, which is that they're putting the Lysol, the odor detection.
Right, those little trees.
Some of those little, the pine scent. New car smell. It's going to be
New
good.
car smells. That's a great one.
It's that, we don't have to reassess our charge master. We don't have to reassess our billing practices. We don't have to reassess our prices because it's being paid, right? That's the thing is there's this assumption, there's a baseline assumption right now that the provider charges are reasonable, objectively so. They need to be paid. And the question is just who's going to pay it. And the provider isn't being forced to ask, is this reasonable? Could we be doing a better job? Is there something else we should be doing? Because why would they?
And so, Ron, you're asking tough questions. And one of the things I'm going to ask when these proposals come forward, I'm always suspicious when, and I'm not saying this is always a bad thing, but here you have physician groups and networks looking to be part of a solution to this problem. And I'll tell you from a policy perspective that if you're part of an entity or you're part of a group that knows it's going to face legislation, knows they're going to be regulated, and you can't stop it, your incentive is to then, okay, I'll propose you a solution. I'll get involved, right? It's like if you're the big drug makers and you know that there's going to be action this year on drug prices, well, okay, you might as well then, we're going to get involved and we're going to propose a solution. And I think we should be skeptical of those proposals. I'm not saying they're all bad, but
no, but you're right, because they come out, they go, hey, let's just do this,
right?
So they get off our backs.
Exactly. Yeah.
And that's
So I
what
think
you're
we
going to
should
start
watch for that.
seeing.
Yep.
Because, this idea that, I love this idea, and I've been reading this all over the place, how in-network is cheaper than out-of-network. Stop trying to separate everything into in or out-of-network. Why can't we just look at the price of the facility, the price of a drug, the price of a procedure? It's not always the most expensive thing that's the right thing. I mean, many times, if you look at it, there are a lot of, they say most back surgeries, I don't know the exact percentages, but most back surgeries aren't even necessary.
Sure.
But yet they're being pushed to have these types of surgeries because they're expensive and it's good revenue for a hospital system, let's be honest. So I just think we have to look at it in a different way. Why is it so expensive in the first place? And what can we do to lower the price instead of just trying to, it's like, it's no different than anything else. It's not black, it's not white, it's not gray, it's just a color.
Sure. And Adam, you talk about the back surgery. How about the patient who's going in and they're saying, I want a surgery. I want a surgery. Because in their mind, they're thinking that this is the most extreme thing they could do, and therefore it'll be the most
Some
effective.
people also think it's the easy way out.
There you
that's
go,
crazy
right?
to think that,
You've
but
seen
some
the
people actually
commercials.
believe that.
So there's a lack of education there. So the provider, maybe they're worried about things like malpractice. If I don't try everything, then they're going to come after me if what I do try doesn't work. Even though, there are all these restrictions on malpractice, people don't realize that. There's still these provider practices that say, hey, look, over-test, because at the end of the day, it's better than missing something.
They say defensive medicine is what the practice is to avoid malpractice lawsuits, and that's bad for the industry.
So this is a pretty crazy time in DC, as we all know. I'm pretty excited to see what's going to happen, not only with the whole government shutdown. Listen, I'll be honest, the whole TSA thing. I was in Atlanta 3 days ago for work. It was already crazy with all the TSA workers calling in sick. What's it going to be like Super Bowl weekend? I can't, and that's the same airport. I'm just saying, they better resolve this before the Super Bowl, I think, or else they'll have some real problems.
Yeah, somebody's going to have to drive. Get the bus fired up.
Guys, today was great. It was a really good back and forth, really energetic performance today on this podcast. I think I'm a little amped up because I'm back. But that's all the time we have for today, folks. On behalf of Brady Bizzaro, Ron Peck, our producer, Pat Santos, and myself, your humble servant, Adam Russo, thank you so much for empowering your plans with the FIA Group. Have a great day.
Thank you.
Thanks.